Good afternoon. We're here with Humboldt County Public Health Director Michele for the May 22nd media availability. Thank you for being here with us.
Thank you for having me.
In his May revise, Governor Newsom has proposed deep cuts to Medi-Cal and in-home supportive services. If these cuts are enacted, how would they impact Humboldt County residents and other programs and services of Humboldt County Public Health?
Well, I would say that we're very concerned about all the health and human services programs that might be impacted by the governor's budget in the May revision, and we're monitoring it closely. We're going to be paying attention for these next several weeks as it kind of plays out with the legislature and the governor as they negotiate and look at what the impacts are going to be for us. In particular, for Humboldt County, it's a concern because we see health disparities greater than the state of California overall. The most major leading causes of death in Humboldt County are 2 to 3 times that of the state. 60% of residents pay more than a third of their income on rent, and the smoking rates in Humboldt County exceed California rates. So there are some factors here when we look at health data, just pre-COVID-19 even, that are pretty significant. And so when you add COVID-19 response to it, we're really worried about what the financial impacts are going to be to serve a community that's already in a worse state than the state is in general. So that's what I'd say.
And this question kind of leads into the next question. As the economic, health, and social impacts of COVID-19 and the shelter-in-place order stretch on, what do you see as the largest impacts to services provided by Humboldt County Public Health, both currently and over the coming months?
Well, it's pretty much all hands on deck in public health in terms of the response to COVID. We've pulled staff from other programs in order to build up such things as contact tracing, the Joint Information Center, the homeless units that's in the EOC, and so in terms of continuity of operations and how are we going to get back to being able to continue to serve and fulfill the programs that we've already been mandated to fulfill, that's something that we're going to be looking at, is how are we going to do that. I'm worried about that personally. I think that the services, a lot of state programs have kind of allowed us to push pause and allowed counties to push pause on some of the requirements and to do things differently, like telehealth or virtual home visits and things like that. But that was not, I don't think that's intended to be super long term. And so we're looking at how are we going to staff those programs still and while we still respond to COVID-19.
Okay. During cold weather, shelters get full more quickly. How are guests at local homeless shelters like the Eureka Rescue Mission and the Kwan Chinn Day Center being socially distanced, and has public health issued a limit to the amount of people they can accept?
Like most sectors that have asked us questions around how to be the safest they can possibly be, the CDC and California Department of Public Health have issued guidance for different sectors, and so we've really referred folks to that, and that's what we're using as guidance as well. A lot of it bases it on hygiene, how can we physically distance people, things like that. So what we've been doing, DHHS has hosted calls with various service providers for different groups, and so people experiencing homelessness is one of them, and so we've really been talking as a group around what are people experiencing in terms of providing services, what are people experiencing homelessness, what's it like for them in terms of COVID-19, what information is needed to get out there, and then what are the gaps that are identified. They've been, we've been referring them to that guidance, and they've been doing a really good job of implementing some of those things. Let's see, we have not set a limit on the amount of people that they can accept, but we have made suggestions around how many people are inside the facility at a given time, how are they doing meals, how are they distributing meals and doing physical distancing in between people, things like that. So they've done a really, I can't compliment them enough on how great they've really done.
That's great. The term of the current county order for the eviction moratorium is close to its end. With increased unemployment and poverty, will public health be advising that Humboldt extend the eviction moratorium past May 31st, and why or why not?
I think that's something that the county is certainly exploring in terms of an option to continue to do that. I would suspect we would look at what the governor's going to continue to do on that, and what the current cases look like and the landscape looks like in Humboldt County come May 31st. But it's certainly something that's on the table.
Is there any sort of outreach being done in the homeless community to test at-risk individuals or those who may be showing symptoms of COVID-19 but don't know where to turn to for medical attention, or what testing or medical resources are available to them?
So like I mentioned, we've been having calls with providers for people experiencing homelessness, and we established a homeless unit in the Emergency Operations Center specific to addressing temporary housing and accessing resources and getting folks access to hygiene opportunities as a preventative measure. And so what they've been doing is working with partners like Open Door, for example, like St. Joe's, like the other clinics around access to care, and implementing a screening process with service providers so that when they're serving the community, they can screen for symptoms. If they screen positive, warranting a test, they can contact Open Door and they can get a test for COVID-19. And we provide transportation from the location that they're at to the test, and then from the testing site to the hotel, where we provide them hotel while they're isolated until they get their test results, assuming it's negative. We provide food during that entire time as well. So let's see, what was the question? We link them. Open Door is our largest federally qualified health center in Humboldt County, and they've certainly been right there with us in terms of identifying folks that are at risk and don't have a medical home. They may have once been an Open Door patient and then kind of fell out of services. They haven't seen them in a while, something like that, and then we can get them linked back to Open Door and they can start accessing care and do care coordination that way. It's been great.
Excellent. How are homeless residents being surveyed for how they are affected? And you basically just answered that.
Right.
So,
there's screening processes that we've worked with providers to implement at different meal times and things like that when they're providing services in order to access a screening process and then getting them linked to testing if testing is warranted.
Excellent. Can you talk more about any safety precautions put in place to try and prevent the spread of COVID-19 among the homeless community? And what would public health's response be if there was an outbreak in the local homeless community?
Sure. We've distributed, DHHS has obtained and distributed dozens of porta potties and hand washing stations that we've placed throughout the county for access. We've also, through the Emergency Operations Center, the homeless unit has obtained and distributed 1,300 bandanas to use as facial coverings to hand out to folks. And then there's a process, various locations for them to turn in a used one and get a laundered one. Once they're returned, we launder them and then redistribute them. And then I would say other precautions are just, again, that the CDC guidance around how for shelters and other various groups that are serving the population of what they can do to stay safe and help safeguard residents that they're serving. When it comes to what we would do if there was an outbreak in the homeless community, rigorous contact tracing. We have increased tremendously the amount of contact tracers that we have. We're up to about 50 or 60 people identified that are getting trained. So we would do rigorous contact tracing, isolating those that are symptomatic or need to be tested, just like we have been. We would continue to do that. We still have capacity to do that.
How can individuals receive financial or other support, and who should they contact?
Sure. I think a good point of contact for folks if they have questions about what resources are out there, especially around financial assistance, the DHHS call center is a good starting place. It's a good door to go through. And then from there they can be referred. That number is 877-410-8809, and they can answer questions folks might have.
Excellent. Thank you so much.
Thanks.